Just a couple points I want to make about the use of the handheld Doppler or the pinard stethoscope in the general practice setting. The use of these tools is best done from 12 weeks gestation, as at 12 weeks gestation is when the fundus of the uterus starts to rise above the pelvic brim. When you're auscultating for the fetal heart, it will generally be found below the level of the umbilicus on the mother. It's generally going to be a bit of a click-clack sound if you are directly over the fetal heart. If you hear more of a swooshing sound, you may have the stethoscope or the probe overlying the maternal blood vessels or the placenta. If you are unsure if you are hearing a heart rate of fetal or maternal origin, take the woman's pulse. This will allow differentiation between the two. A normal fetal heart rate is between 110 and 160. If the fetal heart rate pattern seems a bit unusual or outside of this normal range, then discuss your patient with a GP obstetrician or the ONG specialist team that's nearest to you, as further monitoring of that fetal heart rate is likely to be required.